Another very interesting case is that of a patient who suffered from fibromyalgia for about 30 years. Fibromyalgia is characterized by permanent, chronic pain. As the term says, fibromyalgia in the connective tissue, in the muscles. It must also take place in the nervous system, it certainly does. However, the exact pathophysiology has unfortunately not been clarified to date.
The complaint started over 30 years ago. It actually started with a root-treated tooth, and a short time later, a tonsil abscess came along. And then the problem slowly built up, but I never put it in context. I then went to many doctors, orthopedists, and family doctors. And finally, the diagnosis was fibromyalgia. But actually, it's a disease that can only be described but cannot be diagnosed. I learned to live with it for a relatively long time, I must say. I've already come to terms with it somewhere with a lot of sport, with many things that have made it better.
The patient did sports, intensive sports, a lot of sports, exercise, everything right. She changed her diet to a low-inflammatory diet, to an alkaline diet. This is all correct and very sensible. And because the picture improved only to a very limited extent, she decided to undergo apheresis.
The body has a whole new elasticity again. You notice that when you run. Everything bounces more, everything goes more. I run mainly on dirt roads. But it's like getting shock absorbers again. Everything is very soft and bouncy, and that has just remained. And then I also have to say, fitness has increased significantly. With less effort, I'm able to run more. I run up to the half marathon. It is totally relaxed again. You also sleeps quite differently. That is very noticeable. But then that also continued. Then it was almost a euphoric feeling when you went to sleep, because it's just such a relaxed sleep after a long time.
After apheresis, the patient was almost pain-free. The patient was able to move normally in everyday life again, and had regained her normal daily routine. However, the picture deteriorated again slightly, gradually, slowly, over time. Not to the same degree as before. She was significantly less painful than at baseline, but limited to the point that she decided to undergo apheresis once again.
But then it is actually what is also described after a certain time it has dripped again a little. But then you are also ready to say, I will do another inapheresis, because you have experienced it once. It is indeed the case that so many problematic substances have accumulated in the body that somehow have to get out.
The pathomechanism, that is the mechanism of how this disease develops, is as yet unclear. Why the apheresis helped in this case can be explained most likely with a variety of inflammatory mediators, which we washed out, with autoimmune processes, which are unfortunately not exactly clarified so far, and can also be explained with the washing out of various different environmental toxins. The most common environmental toxins that play a role clinically are the pesticides, are the solvents, are toxic heavy metals, and are plastics. And plastic plasticizers, of course. That plays the biggest clinical role in our experience, and probably will have played a significant role in this case.
It's a completely different quality of life. I have a completely different outlook on life today, and then there are many nice side effects. I have actually had spider veins on my legs for ages. It's almost unbelievable. You look at your legs and the spider veins that have been there for years. They are suddenly gone. The skin texture has become more refined. Somehow, you notice indirectly that a lot is happening in the body, that the body has been relieved. This is a procedure that can really help many people who are hopeless. You just have the courage to do it.
It was shown that with the two aphereses, the patient could be helped significantly. The inflammatory mediators, inflammatory factors, must play a decisive role. With a very high probability also the environmental toxins, from which we could fortunately relieve these patients. We are very happy. We are very grateful that this has succeeded so well in this case, and we continue to work on understanding these diseases.